So biofilm is a protective structure that the bacteria form upon themselves. They grow an extracellular polysaccharide that then they pull in metal ions to crosslink, normally iron, that provides them with a physical barrier to chemical and antimicrobial attack that allows protection for the bacteria and makes them resistant to both antibodies provided by the patient and to external substances applied to kill the bacteria, and really provide them a great deal of protection beyond what you'd have in planktonic form. The majority of SSIs you get, especially when there's an implant in place, are actually biofilm form, the bacteria attached to the implant or to tissue which isn't well perfused, and form this recalcitrant form of infection, which is very difficult to access or break down and continue to infect the patient even after application of systemic antibiotics. Surgx is a sterile antimicrobial gel to help prevent infections after surgery. Surgx works by breaking down the extracellular polysaccharide matrix that protects the bacteria within the biofilm and killing those bacteria by cell lysis. It breaks down that biofilm by chelating out the metal ions that are cross-linking the polysaccharide network and bringing the entire biofilm into solution. Bacteria which are absorbed into the Surgx product are then exposed to the high osmolarity conditions combined with the cationic surfactant, which induce cell lysis. So Surgx has very high efficacy against both planktonic and bacterial biofilms. In the planktonic form, it kills the majority of those bacteria, 6 to 7 log, within a minute or two, and it kills the biofilm more slowly, but about a 4 to 6 log reduction in most biofilms in 24 hours. So Surgx has been tested to be safe for use on mammalian tissue. We have all the ISO safety testing as well as full thickness wound healing data showing that it's non-toxic to the wound as it closes and does not impede wound closure even at the microscopic level. So Surgx is applied to the wound after it's been closed. So after the primary closure, Surgx is applied over the top of the staples or suture or adhesive that's used to close the wound, and it's left there in place. It can last up to 5 days and provides continuous coverage during that time period. Other products on the market are unable to address a bacterial biofilm. They might have some efficacy against planktonic bacteria, but because they do not attack the EPS to break it down, they don't have any efficacy against biofilm that may be present and will allow it to grow upon the surgical site.